group, I wanted to talk about the blood tests you need. You guys, everybody can have one of these. I need some help. I was trying to quietly tear them apart back there, not very successfully. But you can teach, I'm a professional. And I wanted to start with a couple of comments. You know, you guys, will you stop calling yourself, if you're using drugs, dirty? You know, you're not dirty, you're using drugs. We all know that, we don't obsess over, we don't moralize over it, but when you're using drugs, it's not about filth, it's about having a problem. So let's try to remember that you're not clean and dirty, you are you're using drugs and drug-free, please. The other thing is, I have a very good news in that we had submitted a grant to the Gilead Foundation for our Hep C-free Oakland effort. And that is a pilot project to show that if a community bands together, they can do the outreach and testing and treatment they need to shut down the Hep C epidemic in a community. And we were awarded a $30,000 grant to make that happen. I have the budget here, but basically, you know, we'll be working on this. It's a 6-month grant, and we have money to make 10,000 of our workbooks, and we have $4,500 to make posters and flyers and these bracelets and the sunglasses. And we have $2,500 for meetings with people like the BART clinics and all of that. Just, you know, so we can buy free food and whatever it takes to get people's attention. And there's also, for those of you who are participating regularly here and want to help organize our outreach meetings and stuff, there's $6,000 for honoraria and travel expenses for you guys.
Wow. Oh, good.
And then the other piece of the puzzle, since the health department here in Alameda County has been virtually absent on hepatitis C, if you're going to do something in the community and show that it works, you have to be able to measure it, right? And that's called surveillance, right? Surveillance is used in a variety of ways, but surveillance for a disease is when you do surveys or tests or something like that, and look at your intervention and what impact it has on the thing that you're doing, like testing. And the health department should be doing that. They're not doing that. The state's organizing their effort. Probably Alameda County will be the last in line to implement it, and so we're not going to be able to wait. You know, it's time to do this now. And so there's also $4,000 in the budget to develop and implement a basic surveillance system, since we don't have the health department to do it for us. So this is really amazing news. And again, it's only a 6-month grant. And for those of you who haven't been here regularly, our council member has agreed to introduce a resolution, which we will write, declaring March 8th through 15th of next year Hep C Awareness Week.
Right.
And we need to organize our efforts so we blast this community with education and materials and tools and all of that during that week. At every single clinic that sees Hep C patients, all the drug treatment programs, all the syringe exchange programs, all the youth organizations, et cetera, and we'll organize the troops so everybody is helping us. It's not just our little group trying to do all this, because other people are more than happy to help us. So this is very exciting news, and for those of you who need something to do, I have some ideas for you.
Is there using Oasis Clinic, if someone was making a donation to this grant thing to help it, or how does that work?
Is there?
Someone wanted to give?
Yeah, our clinic's a non-profit, so any donations are tax deductible.
Okay, and it would be Oasis Clinic would be used?
Yeah. So a few questions came up about blood tests today, and I thought that we could about what blood tests you need when you have Hep C. We talk about that a good bit, but let's talk about what that really looks like. Because, you know, I think the assumption is that when you go see your doctor and your doctor's ordering tests, they're specifically thinking through the stuff that they're ordering. And I can tell you, as you'll see on here, there's a lot of kind of gestalt to order blood tests. And we're not specifically ordering the things that many times we talk about here in the group. Because when we talk about what liver function tests do you order, what do we usually say? What's the main liver enzyme? Correct. ALT is a very important test because it's a blood test of an enzyme in your liver, and if it's high, what does that mean? Yeah, your liver's inflamed, and so some of the cells in your liver are exploding and leaking into your blood, and you can detect it there. Well, I think ALT is on here,
Yep.
but I have to tell you, almost nobody orders ALT that way. Almost everybody will order ALT in the form of something else that's on this test sheet. See up on the, look under organ and disease panels, comp metabolic panel. You see that? And it has NAK, look at all the things. It has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, about 14, 15 things. You check one box and you get all a bonus of 15 different things. And that's what most of us are sending when you come in looking for something that will test your liver. And you know, you want to know what those doctors are ordering all of these things particularly? No, they're just checking the box up there called comp metabolic panel because you get a sense of what are these things? What's NaKClCO2? What are those? Sodium, potassium, chloride, CO2. What does that tell you?
Blood level?
Blood levels of those things, and what are they for? Yeah, maybe you're dehydrated or overhydrated, or your potassium is low. K is potassium. If you're taking water pills, why do you take water pills if you have liver disease?
So you don't
Yeah, to get rid of
dehydrate.
the swelling, right? What do water pills do to your sodium and potassium? They can screw them up. So those are on that panel. Nobody's thinking through these things, they're just checking a box. How about GLU? What's that? Glucose. A lot of people say, can you test my sugar? And often you'll find if you look at your test, it's already been checked. Why? Because nobody's thinking about checking a box here for the glucose. The next two, BUN, BUN, and creatinine, CR. What are those?
For your kidney.
Kidney tests.
You want the ratio, right? You want the ratio between the and
Exactly. The creatinine is a really important test of how much stuff's going through your kidneys. Your kidneys working, is the stuff going through? BUN and creatinine ratio is very important. Sometimes you're telling what? If you are dehydrated. So you don't have to think through all these problems that people might have. You just check a box and then it comes up. Then you say, oh, that patient was dehydrated. I wasn't really thinking about that. And then we have a whole slew of stuff. Well, actually, after that, there's the calcium. And then we have a whole slew of stuff. TP, what's that mean? Toilet paper? No. Total? Protein, very good. Total protein,
Albumin.
T-Billy, total bilirubin, AP, alpha phosphatase, and AST and ALT. All liver enzymes are on there. And you get all that stuff for one single checkbox. And how much does that cost?
Probably a fortune.
Direct billing to us, believe it or not, we're nonprofits who get better rates, $3.50.
What?
Your insurance company will be billed probably more like $99, but we are actually part of a nonprofit consortium, and so that costs us $3.50. All of that stuff, you just shoot like, about 10 drops in the machine, and all this stuff comes out. So that's often one that's sent. And then what other kinds of tests in a different category? tested for when they show up at the doctor's office? CBC. And you can see down below in hematology that CBC is down there in a couple of different forms. And what do we have? We have CBC plain, and we have CBC with differential. And what does CBC stand for?
Complete blood count.
Complete blood count. What does that mean?
White blood cells, red blood cells,
Good.
monocells.
We look at the white blood cells, and their function is what?
To heal.
Fight infection. The red blood cells, what do they do?
Carry oxygen.
Carry oxygen. And what are the third?
Platelets.
Platelets. Very good. They help clot your blood. These are very important aspects in this diff. What does the diff do? See this CBC with diff?
Yeah.
It differentiates.
Yeah, what does it differentiate?
I don't know.
Different parts of the white blood cells and the red blood cells?
No, those are different enough. It's in one of these categories.
Is it in the platelets?
All the platelets are all the same, the red blood cells are all the same. The white blood cells, what kind of, tell me about white blood cells. Yeah, different ones, like what?
Leukocytes.
Well, leukocyte is a leuco, meaning is white. So those are all white blood cells. What kind of white blood cells do we have? Neutrophils, very important when you're on interferon. What else?
No. Where's our lotto meeting?
You don't need them. Lymphocytes. Monocytes. There's a lot of different ones. In any case, a differential just says, okay, your white blood cell count is 4,500, and this percent or this number is neutrophils, this percent is lymphocytes, this percent is monocytes, this percent is basophils, this percent is eosinophils. So it just differentiates the different kinds of white blood cells. Why do we care?
They do different things.
Well, yeah, why do we care in hepatitis C, for instance? If you're on treatment, why do I always check the diff box?
To see how the treatment is affecting those different white blood cells.
Yes. Yes.
You
You sound like you're answering a high school essay test. You know, what can you just put out there and people are know you're right.
Four different functions and
Yes.
you know
Yes.
if somebody's gonna.
What are you worried about on interferon? Something besides, yeah, why?
I don't know why.
Because it lowers all your.
It lowers your white, putting you at risk for infections. So you're at risk for infections. Do you know what kind of infections you're at risk for? Bacterial infections. Of these, what fights bacteria?
White blood cells?
The white blood cells, which ones? Those are more viral. The neutrophils. Neutrophils are your main bacteria fighters. And so what brand of white blood cell do you think interferon can differentially affect? Yes, because you're more at risk for bacterial infections, such as, do you know what infections you're at risk for? Slightly higher risk when you're on interferon.
Tuberculosis?
No.
Sinus infections, yes. What else? Pneumonia, very good. And sore throat, pharyngitis. And all of those, you're more at risk if your neutrophil count goes down below a critical level. And most of us will consider 500, the number 500, as a kind of a scary level. It's, that's painting a broad brush. But in general, when your neutrophil count is below 500, you're going to be more at risk for infection. And so every time when you're on interferon, when you have those blood tests drawn, those are the things you don't want to miss out on. You want to find out some of that is happening.
Doc, it seems kind of weird that you're taking interferon to boost your immune system, yet your immune system is lacking, and you can get bacterial infection.
And that's a really great question. So what the heck does it mean? If I'm telling you you're at risk for an infection when you're on interferon, but you can fight infections better. Why would that be? How can that possibly make sense?
Because straight right off the hep C infection, but it's slow anyway, so it's.
What kind of,
they're fighting a virus?
what kind of infections are you at risk for?
Oh, bacterial.
Not viral, bacterial, right.
And what are you fighting?
Viral,
Viral.
right.
And these are two different arms of your immune system. And so you jack up this part of your immune system with interferon at the expense of screwing this one up. Okay, they are two different arms of your immune system that allow you to fight infections. And so that's how that plays itself out. The immune system is really very complicated. It's just not just one thing. And so what other things do you need to be checked for if you have hepatitis C?
Low oxygen in the blood.
What of those things would give you that information?
Red blood
Hemoglobin.
cells.
Okay, good. We've already actually talked about hemoglobin, believe it or not. If you look at CDC,
Yeah.
look, what is the first letters in the parentheses? H/H.
Hemoglobin.
What's that mean?
Hemoglobin hematocrit.
Very good.
Talk to somebody.
Hemoglobin what? What was the second one?
Yeah, that's true. Hemoglobin and
Hematocrit.
hematocrit.
Ah,
H and H. What are those? It's obviously triggered with Brad's question about, oxygen carrying. So what are we looking at here?
It's a measurement of.
It's a
how much
measurement of what is hemoglobin. What is the hemoglobin?
How many folks you have to carry the oxygen?
Well, hemoglobin does what?
Carries white blood, carries oxygen.
It carries oxygen. It's the molecule that carries oxygen. So this is a measure of your oxygen carrying capacity. Okay, your oxygen, if you don't have any red blood cells,
Yeah.
if your red blood cells are
So-
zero, how much oxygen are you gonna be able to carry?
Nothing, 'cause
Not
you'll be
much,
dead.
right? You can dissolve a little in your serum, but not much. And hematocrit, what's that?
Is that a ratio of something to hemoglobin?
Hemoglobin is a direct measure of the red stuff. Hematocrit, how do you get hematocrit? You take your blood, which is up to here, you put it in a spinner, and 1/3 of it
Oh, serum,
is cells down here. What's your hematocrit?
plasma.
33. 33%. Hematocrit is just a measure of the red blood cell mass in your blood. That's it. Real
But
simple.
they go together, right? If you're
They
hemoglobin-
track fairly closely.
What's
They're
the normal,
not perfect.
what's the normal count for hemoglobin?
It depends on one main thing that it depends on is what?
Gender.
Gender, right? Who has higher hemoglobin and hematocrit?
Women.
Man.
No.
Men have higher hemoglobins than females. Why is that?
Because men don't menstruate.
Stronger, bigger.
Yeah, so women bleed, and so women lose blood and also lose iron, and so sometimes have trouble making
Right.
more blood because there's just not the raw materials. Sometimes I see hemoglobins that are too high. Why might that be? Why would your body make excess?
Too much protein?
Too much
Again, actually, it can be a bone marrow cancer. Let's say that is possible, but that's fairly unusual.
Infection.
Why would your body maybe try to compensate by making more hemoglobin or more
Because
red
it
blood
doesn't
cells?
filter out the bad ones or something.
Does it have anything to do with the vitamin A? No.
Cigarettes.
Oh.
Some always kill it.
Smoking.
Okay.
Why?
The
Why?
capacity.
Nicotine?
tar.
Because the nicotine blocks out, the smoke blocks out the air and oxygen to the system.
Restrict your purchase.
Yeah, so cigarette smoking, well, it can do stuff like increase your carbon monoxide in your blood, which directly competes with oxygen. But also, what's it doing to your lungs?
Putting tar all over.
Oh,
It's tearing them up. So, you know, instead of having really beautiful little tiny honeycombs,
You've got prunes.
you've got these great big holes, and so you can't absorb as much oxygen in your lungs. And so how does your smart body adapt? Making more stuff that can carry the oxygen around.
Hopefully.
Hopefully, right, at some point, it doesn't do any good, right? At some point, you can't compensate for it. Your blood can get, if your hemoglobin goes up too high, if your hematocrit goes up too high, what happens?
That was my question.
If it can it go up too high?
Yeah,
Sure, that's a good.
so does that lead to maybe stroke or something?
It will lead to why? Why will it lead to stroke?
Because there's too much,
It's too thick.
Yeah.
You know, your blood can get too thick.
Ah.
And so there's a point at which you got too much, you know, ordinarily you got like 40% of your blood is cells, but you know, as it goes up and up and up, your blood thickens up and it just has a hard time getting through all those capillaries and it starts putting you at risk for strokes and stuff like that.
For a heart attack too.
Uh-huh, yeah.
So that's why they give blood thinners to.
Right.
It's one reason, yeah.
That's one reason.
Or shunts.
Uh-huh, that's one reason. Now, if you have a bone marrow cancer that makes too much blood, you know, we usually give chemo to try to bring that down.
Excuse me, what, do they put you on a special diet if that happens?
There would be something you wouldn't want to take. What's that? Yeah.
Yeah, vitamin A or iron.
Iron.
Yeah.
Why?
Because it'll
This is
thicken.
always important to know about iron when you have Hep C, for a bunch of reasons. But if you make too much blood, you certainly don't want to be taking iron, because that'll help your body make more.
Right.
But why is it important to know about iron when
Doesn't
you
the
have
liver
liver
absorb
disease?
iron?
What?
Doesn't the liver absorb?
The liver absorbs iron. Or iron.
Anemia, is it, does it mean to become anemic?
Oh. Well, yes,
What does
It's a
that
toxicity
do?
of too much iron.
that's right.
Ah.
You have not been there long enough, I guess, so still remember all this. Iron can be toxic to your liver. How?
Right, vitamin A poisoning.
Iron is different from vitamin A, but iron is, you know,
Is
how
it-
does this happen?
Does that mean you cannot eat green vegetables?
Liver.
No, not really. I mean, you just might, the main problem we have is people taking iron in pill form.
Supplements, yeah.
But iron actually will be stored in your liver cells, and it can, in large quantities, it can damage the liver cells. And there's a genetic disease where you actually absorb too much iron. And what's that called? Where's Orlando when you need him? You guys, there? Yay! Ooh,
They know how to
Mickey's
get
on
it
a
set at
roll.
some time here. I finally got it in there.
Hemochromatosis?
Whispering it for the whole meeting.
Hemochromatosis. Hemochromatosis, genetic disease where you hold too much iron in your liver. What happens to your liver?
Shuts down?
It rusts.
It rusts, basically. It gets cirrhosis of the liver and you can die. So too much iron is not good. A recommendation, a lot of people want to know, okay, I have hepatitis C and maybe you've been given a pretty clean bill of health. What should I eat? What kind of diet should I eat? That's exactly what I'm saying, by the way. A normal, healthy diet. But I caution people against some things, such as.
Liver,
High protein, low protein?
Pork.
well, yeah.
Greasy food. Or chicken. If you only have Hep C, what about vitamins? Everybody wants to know about what vitamin should I take?
D.
Vitamins with iron
Go on.
Be careful of iron. Why? If you don't have too much iron, you're fine, but you have to be careful because if you already have a lot of iron in your system, you take a vitamin with iron, you could be making the problem worse. And iron in your liver, too much iron can actually reduce your hep C treatment outcomes. And so iron is really important to pay attention to. The others, you know, the water-soluble vitamins will go out in your pee, and the fat-soluble vitamins you can take too much of. And what are those?
Vitamin C, vitamin
Yep,
A.
that's water. A is right.
AD.
It's about time.
These are fat soluble?
These are fat-soluble.
AD&E, don't take those?
No.
Those are fat soluble. You can OD on these. So you can't have too much of these. There's one more. And this is an important one to know with liver disease, the one that's not on here. Yes, very good.
What is?
A, D, E, and K.
Ah,
Vitamin K, which I'm having the darndest time getting people on insurance, is something that may be prescribed to you if you have a very bad liver. Why? Very good. Vitamin K is very important for making your blood's clotting factors. And I was trying to give it to you, RC, right? We couldn't get it. This is a typical story. It's not absorbed as well when you have bad liver disease, just because there's not as much protein in your body to help absorb it, and your intestines can get a little swollen. And if you have not enough vitamin K, then you can't make clotting factors very well. And those of you who know what happens when you have a bad liver,
you bleed easier.
you bleed easier, and often it's because
Hemophilia.
one of the reasons is you don't have enough clotting factors. And an easy strategy to try to improve the situation is to ask whether vitamin K absorption is not a problem, and you might need to take more. Unfortunately, insurance, now it's like a generic vitamin, and if you want to read an interesting article, read the New York Times article about the generic companies and the purchasers keeping the generic prices up by making generic scarce. And that's what's happening with K. It was like $250, $350 a month for vitamin K.
Prescription.
And prescription only, and the insurers won't pay for it, and it's not on the Medicare formulary. Which is all of this being very unfortunate.
It is too, I mean,
It is what it is.
Can you get enough from your food though, Kay?
Yes, you usually can unless you have a very bad liver.
Okay.
So it's a situation, if you have a bad liver and you need it the most, that's when you need to take the supplementation, but unfortunately we aren't able to get it right now. We used to be able to, now we can't. What else, what other tests on here might you be taking if you have liver disease? Okay, because we went through, remember, we just looked at a lot of them on here. We actually had a really broad spectrum just by checking the continental box, the CBC box. What about the thing we were just talking about, blood clotting? What are the PT and INR? Do you see that under CBC?
Yeah.
What is that? And the one below it is another blood clotting test. PTT.
platelets.
Prothrombin time and partial thromboplastin time. Those are blood clotting tests. Why do you want to measure them? Is your liver making enough clotting factors? Right. And how do you test? There it is. How long does it take your blood to clot? It's kind of like that.
Right?
That's the test. So that can be an important test to just check the general function of your liver. And so often, if you're being evaluated for liver disease, that will be on there. And then, yes,
Do hepatitis hurt this part?
it can if it's hurt your liver.
Yeah, that's what I'm talking about, the liver.
But what about you? I told you you have like no scar tissue in your
Yeah.
liver. What would you expect to see on all these tests that I've sent? I've talked
Well, I was
about here.
hoping to find out that something was wrong, like this stuff here.
I know, and all I do is give you good news.
Yeah, I know, but
I know.
now I'm trying to find out. Now, what you said, this PTT stuff, the clotting stuff. Now,
Right.
would that work the same way like leukemia? I mean, could you use the same medicine? Same, the diagnosis or whatever it is?
No, but if you have a real bad liver, unlike you,
Mhm.
what could happen? Your liver can't make clotting factors, and what happens to these tests? They go abnormal.
I don't know, I think
It
you
takes
know
your
about
blood longer to clot.
it. Okay.
So these numbers, these are basically numbers in a ratio, they go up. So they tell me there's something wrong there. It's a
Would that
screening
mean that
test.
you take longer to heal too, if something like this happens to your liver,
Possibly,
the blood and stuff?
possibly, possibly.
So can you discern the same thing from a blood test as like, one gastroenterologist, just poked my arm and caused bleeding and just waited around to see how long it would take me out.
Was it a formal test?
Yeah, it
Yeah,
was,
that's a different test. I haven't heard of anybody doing that in a long time. It's actually a good test. It's a different test called the bleeding time.
right.
It's the best test of all, because that gives you, I mean, basically what you do is you take, an instrument like a Lancet that's standardized, and you go pump, and then at prescribed intervals, you wipe the blood away, you stop watching it, you wipe the blood away until it stops. That's your bleeding time.
Yeah.
That's if you're gonna have surgery and you have all these blood clotting things going on. It's a really good measure because it actually tests you all these things all together as one. So it's a very important test. Hardly
When you
ever
take that
done.
test- Excuse me, when you take that test, don't it take just a few seconds for the blood to start clotting?
All depends.
Not necessarily.
Yeah, that's what they're trying to find
That's what
out.
I have everyone
That's
think.
that's what we gotta find out.
Yeah.
So that's why we do the test. If we already know the answer, then we don't need to do the test. That's another issue.
Okay.
Now that we have the general category of other tests, and that's a slapdash compilation of a lot of different things that could be tested.
Water treatment, water treatment or?
Or before, it depends. A lot of these are on those panels, if you've noticed. The Comp Metabolic panel has a lot of these other tests. Maybe you just wanna check the glucose. You could just check the glucose. Maybe you just wanna check the ALT. You could just do that, but you see, you could also test these individually. But quite frankly, it's often a lot cheaper to do them as a part of a panel. As I showed you, it's just for the whole panel is $350 for our CBC, and the diff is $250. It's really quite cheap. And if you did those individually, it'll probably cost you 10 times that much. So if you need some of those things, even if you don't need all of them, you probably do that. Yes.
Can't hurt, right?
Okay, the CBC.
I do have a question,
Yes.
if you don't mind going back up to the complete metabolic panel. What does the WIF EGFR after it mean?
With,
Completeness, okay.
what does that mean?
Ratio.
With?
Completeness, okay.
Factor ratio?
Good question. They stumped everyone.
Is that a G or a C?
It's a test of, it's a G. It's a test of kidney function. And what does GFR stand for?
Globular filtration.
Yeah.
Oh, very good. Not quite globular.
Globular.
Almost.
Look
Whoa.
over there.
Way to go on.
Glomerular filtration.
Okay.
Here, two said, damn.
Very set.
Why
Oh,
does that test your kidneys?
Shows if they're,
Yeah, how fast does the filtration unit in your kidney go? How much blood is filtered through? How much blood? Glomerular GFR. So you can estimate that. There's a formula for estimating that. And if you want to get an estimate of your overall kidney function, GFR is it. It's indirect, but it can be helpful. There is one other, if you're going on interferon, there's another very important test that needs to be done. It's the most common autoimmune disease that, yes, TSH. TSH.
T.
You see this, I think there's more than one here on this. You see this over into the T's. TSH and is one, and TSH with reflux what are these tests? I'm gonna tell you,
Thyroid, something?
yeah, it is a thyroid test. Why do we care about thyroid tests?
Treatment to put you out of whack.
Interferon can trash your thyroid. It can go up or down. You have to follow the thyroid if you're on interferon. In 5 years, we won't care about the thyroid test because we're not gonna be using interferon very much. But you wanna know if your thyroid is being affected by the interferon treatment. So you do a TSH before the treatment and during the treatment every 12 weeks. TSH stands for
Thyroid stimulating hormone?
thyroid stimulating hormone. Where is that TSH made?
Right here in that.
In your thymus?
Oh, wait,
Thyroid, thymus?
Keep going north.
liver,
Going,
Adrenal?
keep going north.
no,
In your brain.
Your thyroid hormone is made in your neck,
right.
in your brain. Yes. There's a loop
There
that
was nothing
starts.
left.
It's made in one gland in your brain. Very good. Pituitary gland. So it's a I can't even spell it. Pituitary gland hormone. And if your thyroid is shut down, if you're not making it, then there's not enough hormone in your blood, and you're constantly measuring the amount of thyroid hormone in your blood. So what happens if there's not enough thyroid in your blood? Your pituitary says, you're not making enough thyroid, and so what does your pituitary do?
Makes more.
Sends more TSH out to the rescue. And if your thyroid is going south, it's not making enough, if the interferon is causing you to attack your thyroid gland, your TSH level will go up. If you're making too much thyroid because the interferon is set off your thyroid gland, what will happen? It goes down. You will have a lot less of it because it's like, whoa, got enough already. Yeah. And the reflex T4, it's just a time-saving thing. The TSH is up or down, and they'll check the hormone level directly. Just a reflex. Time saver.
Is there a test that just tests like antibodies for autoimmune, period? If that makes
There
any
are,
sense.
for autoimmune, that's very good, because we have not gone through all the stuff that we would test, but two things that I want you to talk about before we're done. You want to know if you're prone to autoimmune disease, right? Why? If you're on interferon.
It'll make it work.
It'll shoot to the stars. And the other thing that I wanted to talk about was something that Charles brought up, which was the liver cancer test. Okay, so those two things we're going to talk about before we go real quick. Autoimmune disease, three things come to mind. There is an ancient test of inflammation in your body that a lot of us would start with, and it is on here. You know what it is?
Is it Cedric?
Very good, sed rate. What the heck is a sed rate? If, I will tell you, if you have autoimmune conditions going on, your sed rate will tend to go up. Why? What does that mean? You got inflammatory mediators that are sticking this stuff in your blood, and the blood will sink at a faster rate. So your sed rate goes up. Sed rate is how fast does your blood sink, basically. That's what it is. You watch it. How fast does it go? And so it's an ancient test because all you do is watch the blood to see how fast the blood sinks. And if it sinks too fast, that may mean you're at risk for autoimmune disease. There's two categories of tests that we often check for that are also on here. They're called ANA and RF. You heard of those? This is the test for lupus, and this is test for rheumatoid factor.
A lot of people with hepatitis C test positive for rheumatoid factor.
ANA, false positive ANAs are not uncommon, and that's why we'll often do all of these to try to understand whether it's a true positive or a false positive. Sometimes we don't even know. Sometimes it can be from the hep C, sometimes it might be pre-existing, and we won't know. And the last thing we don't want to forget is this AFP, which stands for alpha-fetoprotein, and what is that?
Checks for liver, starting of liver failure?
It's a marker of liver cancer. And so if it's up, does that mean you have liver cancer?
Might be pregnant.
You might be pregnant. Now I consider you low risk. So there's two kinds, there's two flavors, there's maternal and non-maternal. So which one do we order? Well, of course, we're gonna do this. This is a marker for birth defects, some kinds of birth defects. But, why could your AFP be up?
High
common.
liver damage.
Very common to have low-level AFP elevations if you have inflammation in your liver. But if it's elevated, then you still pay attention to it. Does it have to be elevated to have liver cancer?
No.
No, it's usually elevated, but not always. But we do check that. Who is at risk for liver cancer? When do you do that test with Hep C? Doctors get this wrong all the time.
Based on level of damage.
If you have cirrhosis. With hepatitis C, very different from hepatitis B. When are you at risk for liver cancer with hepatitis B?
Like the higher stage of damage, like 3 and 4, and you have Hep C. Okay.
When you have Hep C. If you have Hep B, you're at risk for liver cancer. And you're screened for liver cancer for the rest of your life. With C, it's a very different ball of wax if you have cirrhosis. Almost all the cases of cancer related to hepatitis C are related to cirrhosis of the liver. So if you don't, I would never test an AFP in you. Why?
I don't know.
Because you don't have cirrhosis, you're not even close, you're not even in the same
Okay,
universe of cirrhosis of the liver. Could his AFP be elevated?
Yes.
No, he has Hep C. So, but what would happen? So if I sent his AFP test, it was elevated, I'd kind of be obligated to do what?
Biopsy.
Or do an ultrasound, or a CAT scan, or an MRI, and what would it show me? Nothing. It would show me nothing.
That's what I was gonna ask you.
Right, so why send the test?
Well, it did work for me, but anyway, you had the right friend thought, you
Right.
had interest when you're talking about cirrhosis with the rest of the seat.
You send the AFP if you have cirrhosis of the liver. If you don't have cirrhosis of the liver, for you, nobody should be checking your AFP. But if you have cirrhosis of the liver from hepatitis C, you get checked forever. Just forever, every 6 months, 4 to 6 months.
Oh.
You get checked regardless. You are still at risk.
So with B, you don't have to have cirrhosis before
Right.
you can get liver
You
cancer?
get screened for just automatically.
That's why they have such a high rate.
Right, you just
Oh,
start
okay.
screening right away, young people with hepatitis B, everybody with hepatitis B gets regular screening for liver cancer. You should not be doing this in people who don't have advanced liver disease with C, does not make any sense. You just get abnormals and then you're chasing your tail. There,
I have cirrhosis and they do a sonogram every 6 months. So should they be doing an AFP as well?
you know why I would? Just because, let's talk, how, looking at a tumor in your liver, it can be hard to see. You have cirrhosis, and what does your liver look like? It's kind of, ratty around the edges, and you kind of see things like that. It looks a little bit like that. And so you're trying to see with an ultrasound, which measures the density of your liver, a little thing here. And it doesn't show up so well on an ultrasound. With the other two are better. The best one is MRI. They put in dye. And what happens to dye and what does liver cancer do with dye? Sucks it up. It's full of blood vessels. So these are the better tests. This is the best test to have if you're screening for liver cancer. But we will often compensate by doing an ultrasound. And I would send an ultrasound unless your AFP were up, and then I would send you for the better test. Because there's radiation with this one. This one's real expensive, and they're a lot more difficult than an ultrasound. So I'll do both of them to compensate for the fact that I'd rather do an ultrasound because they're a lot healthier for people. Yeah.
I was just gonna say, in screening for a hepatitis C patient who has cirrhosis for liver cancer, does that involve blood work or CT scan or ultrasound? Which?
Both. You need blood tests. You should probably have blood tests and an image. You need a picture and blood tests. That's what we were talking about. Your blood test is called an AFP, and the image test is an ultrasound, or a CAT scan, or an MRI.
All right.
All of those are considered acceptable, but this is the best, this is second best, and this is third best.
Okay,
Yeah.
thank you, Doctor.
Yeah. Okay, we're done.
Thanks,
Thank you.